Since its founding, Penn has been the home to medical practices and research and treatment that reflect the broader medical changes of every era. The implementation of medical knowledge from Europe, expansion and specialization of education and treatment, and emphasis on collaboration throughout time have made Penn what it is today.
Thomas Evans was a Philadelphia-born dentist who embodied the innovations of his time. He utilized new practices like anesthesia and asepsis to treat his patients, collaborated with many other doctors, and created a legacy that allowed for the development of the Penn Dental School.
Collaboration efforts in medicine continued at Penn with the development of the Roberts Proton Therapy Center in 2009. Proton therapy involves a comprehensive team of professionals who use science and technology in cancer treatment.
Since the founding of the University of Pennsylvania Medical School in 1765, the adoption of new practices in education and treatment at Penn have reflected the broader changes that have occurred in medicine in the last 250 years. The story of founding Penn Medical School is one that is both rooted in long-standing traditions in medical practice and cutting-edge innovations. The medical school was founded by John Morgan, a Philadelphia native and Penn graduate, who had received medical training in Edinburgh, Paris, and London. At the time, and for centuries prior, Europe was the world center for medicine. Morgan founded Penn Medical School based on two main principles he had learned in Europe. First was the idea from Edinburgh that a medical school should be established within a broader university. Before 1765, Penn was already home to the so-called charity schools, the college, and the academy, which taught English, math, and Latin. The inclusion of the first medical school in America also made Penn the first institution to offer both undergraduate and professional education. The second founding principle from Europe was the idea of supplementing medical lectures with bedside teaching. The college was the perfect place as, at the time, it was located downtown at 4th and Arch, within a few blocks of Benjamin Franklin's already established Pennsylvania Hospital. Penn Med's initial curriculum and the faculty appointed to teach it reflected a conception of medicine that was yet to become highly specialized. John Morgan taught the theory and practice of physics, and co-founder William Shippen Jr. taught anatomy, surgery, and midwifery. In 1769, the medical school added as a chemistry professor notable Philadelphia physician Benjamin Rush, who had also obtained medical training that exemplified a tradition of apprenticeship in medicine that goes back thousands of years. However, Rush's medical philosophies themselves were distinct for the time, focusing on nervous system stimulation and cleanliness, although not germ theory. The Revolutionary War halted the development of the medical school as Morgan, Rush, and others left to serve as medical professionals for the Continental Army. But when they returned, the medical school was reorganized in 1791 with 3 new professorships, including natural history, botany, and clinical medicine. By that time, the graduation requirements were much more rigorous, reflecting an increase in systemization and professionalization of the medical field. The option for a medical bachelor's degree was abolished, and all medical doctorate recipients had to be at least 21 years old and have studied medicine for a minimum of 3 years, with at least 2 years of this study taking place at the University of Pennsylvania.
Dr. Thomas Evans was born in Philadelphia in 1823. At 14 years old, he was making dental instruments, and at 20, he received his diploma from Jefferson Medical School, allowing him to practice dental medicine. There was no formal dental education at the time, but Dr. Evans planned to change that. Dr. Thomas Evans moved to France soon after receiving his diploma and later became the dentist for Napoleon III. During the Civil War, Napoleon III was considering supporting the South. He sent Dr. Evans to meet with President Lincoln and Secretary of State Seward in 1864 to determine the best course for the French. Evans was a big influence on Napoleon III and was able to convince him to stay out of the Civil War. Doctors were already gaining a lot of respect and influence in the world. During Dr. Evans's time in America during the Civil War, he saw the Union Army's hospital and was so impressed that he purchased an army hospital and had it shipped to his home in Paris. During the Franco-Prussian War, Dr. Evans used this army hospital to care for the wounded French soldiers. Those who were treated in Evans's hospital had a higher survival rate than those treated in the French hospitals, as the American tents had open flaps and thus reduced the transmission of airborne infection. Dr. Evans was very willing to try new innovations like germ theory to help his dental practice. While Dr. Evans was in America, he learned about the use of nitrous oxide for general anesthesia. He invited American pioneer of nitrous oxide, Gardner Colton, to Paris, and they introduced the anesthesia to the European medical and dental communities at Paris World's Fair in 1867. Collaborations within the medical community were on the rise. After France's defeat in 1870, Dr. Evans is known for aiding Empress Eugenie in her escape from a mob of revolutionaries. He was one of the most well-known, respected, and influential doctors of his time. Though Dr. Evans was known for having collaborated with many other doctors to bring medical innovations to America, he had superstardom of his own. This reflects the transition into the golden age of medicine, where doctors were held in very high regard. When Dr. Evans died in 1897, he left the bulk of his estate to the establishment of a museum and dental school in Philadelphia on the site of his family house on the northwest corner of 40th and Spruce Streets. Dr. Evans's life reflects the collaboration between the late 19th and early 20th centuries, as well as the upcoming respect for doctors in the golden age of medicine. His willingness to utilize new practices shows the quickly changing world of medicine at the time. He used the knowledge of germ theory as well as anesthesia to aid the care of many in his time, as well as establishing a name for himself that helped to create the Penn Dental School, an institution that has always been on the forefront of dental medicine in Philadelphia and the world.
On January 8, 2008, a 200-foot-long trailer truck delivered a 220-ton cyclotron to the Perelman Center of Advanced Medicine on 34th and Civic Center Boulevard. This world-renowned machine would be an integral part of what would be known as the Roberts Proton Therapy Center, part of the Abramson Cancer Center of Perelman School of Medicine. Proton therapy offered at Penn is unique because of the collaborative efforts of many leading experts and specialists to provide comprehensive and multifaceted care to patients. The use of proton therapy highlights several larger themes within the history of medicine, including the rise of specialization, changes in doctors' understanding of the human body, and the application of scientific knowledge to clinical care. Proton therapy is used to treat several types of cancers, most notably brain and spinal cancer. It essentially shoots protons at high speeds into tumors in order to kill cancerous DNA before reproduction. Proton beams can enter the body at lower levels of radiation and increase radiation to the necessary amount in the last 3 millimeters of the beam. In proton therapy, unlike in X-ray therapy, protons release energy once within the target cell, therefore, few other cells are exposed to harmful effects. Higher energy protons release deeper doses of radiation. Thus, experts can calculate the energy necessary for doses to match the depth of tumors. A revolutionary device that more precisely measures tumor shape is the multi-leaf collimator, unique in the U.S. to the Roberts Center's cyclotron, that allows patients at all of Penn Med's facilities to get the most precise care. Once protons exit the tube at adjusted energies, the multi-leaf collimator is used to further match the proton with the structure of the tumor. Proton therapy is an emblem of 21st century medicine. It reflects the application of increased scientific knowledge into clinical care, such as medical professionals' application of harnessing subatomic particle energy to destroy DNA of cancer cells. Additionally, proton therapy requires a team of people, including oncologists, nurses, dietitians, patient navigation specialists, radiation oncologists, radiation therapists, technicians, social workers, and surgeons to deliver care. This increase in specialties within medicine was formally established in 1933 with the American Medical Association establishing the American Board of Medical Specialties as the authoritative figure in licensing medical specialties. Presently, the rise in specialties and subspecialties continues and accompanies increased scientific discoveries. As exemplified by the use of proton therapy from the mid-20th century until present day, increased technology and the scientific information and diversification of the medical field has changed the players involved in patient care and how patients are viewed and treated.
Since its founding, Penn has been the home to medical practices and research and treatment that reflect the broader medical changes of every era. The implementation of medical knowledge from Europe, expansion and specialization of education and treatment, and emphasis on collaboration throughout time have made Penn what it is today.